Hi guys, it's Belle from GLYCOLIC here and welcome back to the second instalment of our brand new series where I'll be educating you all about the 3 primary acids. So our first video was all about salicylic acid and I really hope you took something away from that video, because out of all of the primary acids it is probably the most renowned for its usage and effectiveness, as acne and breakout concerns are just so common. Today we're talking all things glycolic acid, and I'm going to really break it down to help you understand, as it can be quite complex. So by the end of this video, I hope you'll be confident in knowing about its origins, uses, functions and benefits, whilst ticking off that checklist box to know if it is suitable for your usage too. Don't forget to click on the notification bell so you never miss a video, and let's get started. In its earliest incarnation, glycolic acid was a totally natural ingredient derived from sugarcane. However, these days manufacturers often make it synthetically. Sugarcane is also used medicinally, not only to sweeten pharmaceuticals, but in the past as an antiseptic, diuretic and even a laxative, and has even been used to treat all manner of concerns from stomach ailments, sore throats, wounds and even snake bites. Glycolic acid is classified as an alpha hydroxy acid, so an AHA, making it highly soluble in water, with it being completely odourless and colourless. It is the smallest AHA, making it an effective exfoliating compound, whilst also helping to maintain as much of the skin's natural moisture as possible. It can penetrate into the more superficial layers of the skin, where dead cells accumulate, causing the skin to look dull, and it helps to destroy the attachments that hold dead skin cells together, allowing them to slough off and make room for new skin cells to grow. Although an acid may sound a little worrying, glycolic acid tends to cause less irritation than a facial scrub, some of which can cause small micro tears in the skin. As with salicylic acid, glycolic acid is present in many different products. And as mentioned in my previous video, to differentiate between the different functionalities, just remember, in a cleanser form, it will be washed off the skin. In a mask form, it will absorb into the skin for around about 15 minutes and then be washed off. And in a serum or treatment solution form, it will naturally absorb into the skin until the epidermal layer dries, with it going from a cleanser being the most mildest way to treat, to either a serum or a treatment solution being the most intense way to treat, based on percentage, formulation and stability. And make sure you do your research, of course, and ask a skin expert to help you if you feel it's necessary. Because glycolic acid is one of the most exfoliating acids, it should be limited to only be used about 1 to 2 times a week based on its formulation. Then if your skin starts to show tolerance, it can be increased to be used around 3 times a week, but I would suggest no more than this. If you have dull skin concerns and to the touch it feels quite rough, it's likely you have a buildup of dead skin cells. So by incorporating a glycolic acid facial cleanser every 3rd evening, this will start to effectively exfoliate. You could incorporate additional masks, treatment serums or treatment solutions hosting glycolic acid if you feel your concerns are more severe, but it can be quite irritating if used too frequently. So always take precaution there. If your skin is dry, having more of a flaky appearance, this is a dehydration issue, and to combat that you really need to start using a hydrator with immediate effect. Using glycolic acid on a skin like that won't have adverse effects. However, skin flaking is a common side effect of dehydration, because it means the skin moisture isn't sufficient enough to encourage the growth of new skin cells. I'll touch on the characteristics of dry skin in comparison to dehydrated skin and how best to tackle these in another video. Now, listen up carefully guys. This is not me prescribing to you or recommending that you go out and start using glycolic acid immediately. As to maximise your skin's safety, you really do ideally need to undergo a full suitability assessment prior to ensure that it's actually approved for your usage. As when incorporating an active acid into a skincare routine, it's important to know it needs to be supported with hydration and protection, as well as having a fully formulated skincare routine to support it. And remember, acids make cellular changes. They aren't to be taken lightly, and if abused, they can lead to complications. Glycolic acid is mainly used to heavily exfoliate the skin, stimulating new cell growth. But it does have strong anti-aging potential as well, as it stimulates collagen and elastin fibres which firm the skin, making it more bouncy to the touch. It has been proven to have high efficiency over multiple decades and studies, with it also being shown to be effective when treating acne, hyperpigmentation and skin discoloration. It can also prevent ingrown hairs, so keratosis pilaris, which is the bumpy texture that you tend to find on the top of the arms, because it breaks up the dead surface skin cell layer, which sometimes leads to blockages. It's also commonly recommended as a treatment option that can be undergone at a professional skin clinic too, with it being a popular choice for texture and discoloration concerns. It's mainly effective within resurfacer or chemical peel solutions, and depending on the percentage of glycolic acid present and the protocols, treatments can sometimes be performed as little as 2 weeks apart. A few things you'll need to know if you're considering starting using glycolic acid are, in most cases, it's not best recommended for sensitive skins. It can cause skin dryness and irritation if not correctly supported with a formulated skincare routine. It can actually cause skin burns if the usage is abused. It makes the skin photosensitive, so should always be supported with a sunscreen, and it should be limited in its usage in combination with other AHA or BHA acids within the same application routine. You should gauge by speaking to a professional whether you indeed need to use it at all, as it isn't for everyone, but be mindful in knowing that there are definitely alternative solutions. Stay tuned for further skincare videos like this, and remember, here at GLOBE we're all about maximising your skin's health, helping you make better skincare choices. If you have any questions, or if you would like to obtain advice about your skin, then you can book in for a virtual skin consultation at globe.co.uk with one of our skin experts today. Stay tuned for the final video in this series where I'll be talking to you all about lactic acid. Thanks for watching, and I look forward to chatting with you again soon.